My name is Marilyn Amento. I'm an ADAO Pennsylvania State Representative for ADAO. One of my pet peeves for years is people rushing to the sites of building implosions because they're just so fascinating. And in Philadelphia, we had the Spectrum was imploded and Veterans Stadium was imploded. And I'm always saying there, my God, that has to be asbestos, and why doesn't anybody stop it? I'm sure you're all kind of nodding your heads. I'm kind of, speaking to the choir here. But that's just pretty much a statement more than a question. Does anybody know of anything that the EPA or OSHA or anybody is doing about these building implosions?
Well, there are regulations to remove all asbestos before a building is demolished. However, there's always exceptions, and certainly a complete EPA survey isn't necessarily going to find all the asbestos that might occur from such implosions. But there are regulations in place that state that all asbestos material should come out of a building before it's demolished.
Anybody else want to make comments? The lady there.
This is Brent Kynock from Maryland, and he's the managing director of the Environmental Information Association, a multidisciplinary independent organization. So those asbestos abatement questions on the safety level could be directed to Mr. Brent Kynock, I believe, during the afternoon. Thank you, Brent. Dr. Levin?
Well, I just want to comment on the last issue that was raised.
Use this first.
Yeah, and Terry Lynch will remember well that the asbestos workers, or the insulators, came out in opposition to a series of tests that the EPA was running on demolition of buildings with and without removal of asbestos first, because it was clear that the EPA wanted to move in the direction of allowing buildings to be demolished, imploded, without removal of asbestos first. And their intent was to save the money that was involved in asbestos removal. And I thought that the asbestos insulators, or the insulators, played an excellent role in opposing this because of the public health implications of doing that kind of work. So this is by no means a settled issue, and it would not surprise me, even under the current administration, that the EPA might go further with this approach and try to implement a policy that says you don't have to remove asbestos first before you demolish buildings that contain asbestos.
I just want to quickly respond to that, Doctor, and you're right, and that was in the Texas area. A couple different times where they wanted to use a wet method. They wanted to use a wet method and just say they were going to hose it down and everything would be fine. And what they did, they really rushed just before they tried to get that done in Fort Worth. They tried to get it done at the end of the last administration, and they weren't able to do it. They weren't able to do it, and we were right there with them all the way through that thing, and they're withholding their reports on their findings also.
There are, along with the Asbestos Disease Awareness Organization, there are many other organizations in this room today that have been working tirelessly to ban asbestos. And as we talk about these issues, we need to step back and reflect that we in the United States, along with Canada, do not have a ban of asbestos. And in a 100-pound bag of play sand for your child, legally, there could be a pound of asbestos. So together, we can change policy, and I hope that you'll take a look at our website, Ban Asbestos US, educate yourself with the facts, and send a letter directly from our platform to your member of Congress.
Yeah, I just want to make one point about the demolition of buildings. There was a graphic picture of the World Trade Centers collapsing and the statement that 400 tons of asbestos was released. If you look at the initial statements by the EPA and all the state agencies out there, they didn't find any problem with that. Now, subsequent to that, we know the harms that occurred to many of the response workers who had very inappropriate protection, and a lot of the people that lived in those areas as well. So, we need to, again, it gets back to a lot of the ethics in what we're doing, and when there's unknowns, I think we need to be more precautionary than to kind of hurry up and clean things up, which seems to be more of the trend lately, is just do things quick and fast and inexpensive, as opposed to worrying about particularly the longer term effects to the population. I know Tanis Hernandez from the CARD Institute out in Libby, Montana is here speaking, and I had the pleasure of sitting through one of her presentations a couple years at the American Public Health Association. She did a presentation on asbestos, the slow motion disaster, and she contrasted how, you know, when hurricanes hit, earthquakes hit, people respond to those issues right away, but asbestos takes such a long time to show up that there just isn't that sense of urgency and that long-term support. So I think we really need to educate for a longer-term view as well, and certainly these demolition issues fall into that.
Hi, I'm Julie Gunlock. I'm a peritoneal mesothelioma patient. And my question is partially abatement, so I don't know if this is the appropriate time, but I know the horrifyingly long list of items and construction items that asbestos was used in. And, you know, everyone knows if you're removing, you know, asbestos siding, asbestos tile, that you need abatement. But what about, I mean, is there any way to know, was it in the drywall mud in the walls that I have? I mean, do I need to look at professional abatement just to do minor remodeling in a house? I think that's something that isn't really addressed to the general public. I mean, the more obvious sources of asbestos we speak to, but the more insidious ones, how do we deal with that?
That's a pretty tough issue because currently our regulations are for public buildings. Certainly our initial response was in our schools. We were concerned about exposure to our children in the public forum and the responsibility to public health. But the individual, in your home, you could have joint compound that you bought at Home Depot. It could be a DAP joint compound that you applied yourself that could contain asbestos. You're asking me, how do we prevent that? We don't. The only tool we have to combat that today is awareness.
Is there any thought to doing a suit under Freedom of Information to get the report on the results of that demolition with the water?
Paul, in all honesty, we haven't really had time to pursue it. We were just so elated that they had stopped it, you know, but that's an interesting concept. You know, I kind of think that maybe it's, you know, and this is probably pie in the sky, but I'm kind of hoping like right now that it is kind of going to go away, you know, and I feel that they tried very, very hard to rush it in before that last election, and you know, and I truly believe that this current administration, that you can feel it where they're more concerned about the health and safety of workers. You know, and it's something just like everything else. It doesn't happen overnight.
You know, we can't count on the administration lasting forever,
I know.
I'd love to put a nail in that coffin, you know, let's kill that.